Namaste, my name is Dr. Snigdha Komakula. I am consultant neurophysician at Prathama Hospital, Kukatpalli. So let us know what happens in the brain during brain stroke. During brain stroke, the blood vessel which supplies to the brain either gets blocked by a clot or it gets ruptured. Because of reduced oxygen supply to the brain, either the neurons die or they get damaged. So because of this, patient can get a short-term or long-term disability or either death can occur. What are different types of brain stroke? So basically there are two major types of brain stroke, that is ischemic stroke and hemorrhagic stroke. Ischemic stroke occurs when there is some clot which obstructs the blood vessel supplying the brain. And hemorrhagic stroke occurs when the same blood vessel gets ruptured and there is bleeding into the brain. And there is another type of minor stroke also called as transient ischemic attack, where the clot obstructs the blood supply to the brain only for few minutes to few seconds. So during this period, patient develops symptoms transiently and which improve within minutes to hours. What are the important signs of stroke? In order to increase the awareness to the patients and so that the patient comes to the hospital early, CDC has come up with a short acronym of stroke symptoms, that is BFAST. B stands for any impairment in the balance while walking. E starts for any eye changes, that is any blurring of the vision or vision loss. And F starts for any face numbness or face paralysis, and A starts for any arm weakness or arm numbness, and S starts for any speech disturbance like any change in the speech or change in the voice, and T starts for immediate action on time, that is immediately they have to approach a nearby hospital or call an ambulance. Please be aware of these things, that is be fast, and we have to act now on this. What's the importance of BFAST acronym and why should we know the stroke signs and symptoms early? So why these acronym and these symptom awareness has been increased among the people is so that the patients has to approach to the hospital very early, and the doctors also need to act very fast in any acute stroke patient, because every minute counts and many number of neurons will die, and there will be increase in the disability to the patient. And this disability, the more it increases, the less chances of recovery can be there for the patient. So if the patient comes to the hospital with an ischemic stroke, within 4.5 hours to the hospital, there can be a treatment called thrombolysis, which cannot be given if this period from the onset of stroke is more than 4.5 hours. So that's why we need to know the importance of stroke signs, and immediately patient has to rush to the hospital after knowing the stroke signs. What are the major causes for the brain stroke? Important causes like hypertension, diabetes, uncontrolled cholesterol levels, obesity, reduced physical inactivity, smoking and alcohol consumption, also obstructive sleep apnea and increased age. All these are very important major causes for the brain stroke. So we have to take a precaution for controlling all these things so that in order to prevent a brain stroke. What's the relationship between a brain stroke and a paralysis? Not all paralysis are because of brain stroke, but a brain stroke can cause paralysis. Other than paralysis of one side of the hand and leg, brain stroke can cause other symptoms like either vision loss, blurring of vision, speech difficulties, mood changes, loss of memory, and also sudden loss of consciousness or seizures like fits. All these can be the changes because symptoms because of the brain stroke. But all the paralysis reasons may not be just because of a brain stroke. There can be other causes of the paralysis. Once a paralysis occurs because of brain stroke, then the recovery chances will depend on how large the brain stroke is and how early the treatment has been started and how good the rehabilitation and physiotherapy has been started for the patient. How to recover from a brain stroke? So once a brain stroke occurs, as the brain is the important center for controlling our heart, respiration, our moods, emotions and our motor activity like movement of our hands and also sensation of our hands, our vision, speech and everything, any of these things can get affected. So the main important role will be with the rehabilitation. So this physiotherapy or rehabilitation has to be started within a day or within 2 days after the onset of the stroke. So this improves the recovery of the stroke, and the early the rehabilitation is started, the better the outcome will be. And at the same time, the patient should also take a note on control of their blood pressure, control of their cholesterol, control of their sugar, and also having a healthy lifestyle in the form of regular exercise and also regular healthy diet, which includes their taking good amount of fruits and vegetables into their diet. And apart from this, they have to be in regular touch and follow up with their neurophysician and or neurosurgeon, and they have to be also regularly taking their medications like antiplatelets or anticoagulants, which are basically given for their as a stroke treatment. So taking all these precautions, the recovery post stroke will be usually good with the patients, especially if there is a mild to moderate stroke. And if the stroke is very large stroke like a severe stroke, then the rehabilitation has to be much more increased. Apart from the physiotherapy, other bed care and daily needs has to be supported for the patient.